What if one of the most powerful mental health tool is not a pill bottle, not a hospital, and not even a therapist office, but a park or a trail or a pond or simply sunlight on your face? Hello everyone, Dr. PK. Today I want to talk about something fascinating, hopeful, and very important. A new report from UK describes a mental health program where doctors are actually referring their patients for a structure dose of nature. And according to the article, this is not just a wellness trend, it is being used as a real therapeutic intervention for people struggling with anxiety, depression, stress, and other mental health challenges. Now, let me be very clear from the start. I'm not saying nature replaces all psychiatric care. I'm not saying people should stop medication or therapy or ignore serious mental illnesses. But I'm saying this modern medicine is increasingly recognizing that the human brain and body respond very deeply to the natural environment, and for some people, that the response may become a powerful part of treatment. So, what is this program? The article focuses on UK charity called Dose of Nature. Their model is simple but structured. Patients are referred often by general practitioner, and then they take part in this 8-week program. That's 2 months with guided one-to-one sessions outdoors. These are not random walks. These are intentional sessions led by trained guides designed to help people reconnect with nature and use it as a part of mental recovery. The that structure matters because one reason many people do not benefit from general advice like, oh, go outside more and something like that, and people are exhausted, too anxious, too depressed, too overwhelmed, or simply too disconnected to start the whole process on their own. So a structured and well-supported program lowers the barrier. Why might nature help mental health? Let's make this simple. When a person lives in chronic stress, the body often says stays in low grade fight or flight state. The stress hormone stays elevated, sleep may worsen, and rumination increases. Attention becomes scattered or overly narrowed. The mind becomes stuck in loops. Nature may interrupt that loop in several ways. First, natural light helps regulate circadian rhythm, which can improve sleep wake timing and mood. Second, the green space and natural scenery may reduce mental overload. Urban life constantly pushes the brain with noise, screens, traffic, alerts, and stimulation. Nature often does the opposite, right? It restores attention instead of draining it. Third, sounds of nature like bird song, flowing water, and wind can reduce perceived stress and help the nervous system settle down. Fourth, being outdoor often increases gentle movement, which itself helps mood, metabolism, and anxiety. And fifth, nature may help feel less trapped inside their own thoughts, right? This is a major point. Sometimes healing starts when the mind stops and circling the same painful loop and reconnects with something larger, calmer, and real. What results did they report? According to the article, the program has delivered about 1,500 one-to-one courses. It reports a 64% recovery rate and 86% reliable improvement compared with the benchmark figures of 50% recovery and 69% reliable improvement for a standard NHS talking therapies mentioned in the piece. That does not automatically mean nature is better than therapy in every situation. We have to be careful and scientific here. Different patient, different methods, and different comparisons matter, but it does suggest that nature-based structured care may be very meaningful tool, especially for people who are not fully improving with conventional treatment alone. The article also says that researcher from London School of Economics followed hundreds of patients and found clinically meaningful benefits with an estimated social return of about $8 for every $1 spent. This is important because it suggests that it may not only help patients but also reduce the burden on healthcare system. So one reason this story is powerful is because of the personal account. The article describes participants who felt the nature-based sessions helped them regain stability, calm, and emotional balance. One participant with bipolar disorder reportedly said that the approach changed his life and that he had gone years without a manic episode. Patient stories are not the same as clinical proof, but they remind us of something important. Healing is not always about one medication or one test. Sometimes it's about changing the whole environment in which the brain is trying to recover. So, why this matters in modern life? Let's be honest. Many people today live in an unnatural rhythm. Too much indoor time, too much screen exposure, too little sunlight, too little movement, too much noise, too little stillness, too much isolation, even while digitally connected. And when we wonder why anxiety, burnout, poor sleep, low mood, and chronic stress keeps rising, of course, mental health illness is complex. Trauma, genetics, finances, relationships, neurobiology, substance abuse, sleep disorder, inflammation, medical illness all matter, but environment matters too. If person spends nearly all day indoors, sedentary, overstimulated, sleep deprived, socially disconnected, and mentally exhausted, then restoring some connection to nature is not a luxury. It may be part of restoring baseline human function. So, who benefits? Nature-based therapy may be helpful for people who have mild to moderate depression, chronic stress, anxiety symptoms, burnout, grief, loneliness, adjustment difficulties, emotional exhaustion from chronic illnesses. But this is very important. If someone had severe depression, suicidal thought, psychosis, mania, substance abuse, inability to function safely, they need urgent medical and mental health evaluation. Nature can be supportive, but it is not a substitute for acute psychiatric care. What can regular people do to start something now? We may not have access to a formal program like Dose of Nature, but you can still apply the principle, right? Spend 20-30 minutes outdoor. Most days if possible. Walk in a park, garden, trail, any green space. Put the phone away. Notice light, air, sound, leaves, birds, water, sky. Pair outdoor time with slow breathing. Make it consistent effort. And if you're struggling, ask a friend or family member to join you. Research has suggested that around 120 minutes per week in nature is linked with better self-reported health and well-being. My take is nature should not be dismissed as a soft medicine. It's not magic. We are spiritual. We are natural. It's not a cure for all, but it may be powerful adjunct therapy that works through sleep regulation, stress reduction, movement, sensory restoration, and emotional reconnection. The future of medicine should not only be more about pills and more procedure. It should include smarter use of lifestyle, environment, behavior, and social connection and nervous system recovery. Sometimes the brain does not just need chemistry. Sometimes it just needs context. And nature may be one of the most underused healing context we have. So yes, this Guardian article is helpful. And do not underestimate what daily sunlight, green space, fresh air, movement, and quiet can do for your mind. For some people, a dose of nature is not just relaxing, it may be the beginning of recovery. Thank you for watching, thank you for following, and I'll see you in different video.